I'm sure some of you are wondering what are the top or most common bedside nursing skill that you need when you arrive here in the United States. So for me, I just wanted to bandwagon in and ask ChatGPT and see what answers he or she or what this thing can give us. So for number one, the answer that he told us is administering medications. So we are responsible for giving medications to our patients, and that is basically our everyday thing. So definitely you have to know how to give the medication, and more importantly, the effect of your medication. So you have to know those things, like for the blood pressure, like the effects on the laboratory labs, and all those things. So basically that is definitely normal. So number two, says here, wound care. Nurses are responsible for assessing and treating wounds, including cleaning and dressing wounds and monitoring for signs of infection. And yes, definitely. As a nurse here in the United States, it is vital for you to document those things, especially during admissions, namely pressure sores, because these things are like a big thing here in the United States. If it wasn't recorded during the admission and on the following day it was seen as a patient having a bed sore, then it might be tagged that the pressure sore happened during the stay here in the hospital. So that's a big no-no for management. Also, you should know a specific protocol for your particular hospitals on how they do the wound dressings, how they clean it, how they document it, and everything. Different hospital, different setting, different management. So number three, vital signs monitoring. Nurses are responsible for monitoring patients' vital signs, including blood pressure, heart rate, respiratory rate, and temperature. Of course, this is definitely a basic thing. But one thing to note here is you should be able to do a manual blood pressure. Sometimes, typically like for when we're doing vital signs and the blood pressure is kind of high, they normally ask the nurses to check manually and see how the blood pressure is. So I did encounter some people who doesn't know how to use a manual blood pressure. So you definitely have to have that on your skill. Then next will be catheterization. Nurses may insert and remove catheters to help patients who are unable to urinate or require continuous drainage of their urine. And yes, this is a typical thing here for us nurses. Most likely we are allowed to insert Foley catheter, and normally we are the ones doing that. Especially for in and out catheters or like a straight catheter, we are the one doing that. We don't even have to have orders for that. So the only time we need an order for most of the hospitals is with a Foley catheter. So you have to be able to practice like a stereo technique when doing these skills, particularly on female patients. That's one of the hardest thing. And another tip I can give for those inserting for female patients is try to put something under the buttocks, like a towel or a small blanket, then bring two Foley catheter insertions or two in and out catheter set. That will definitely help you save time. For those asking why, because the towel can raise the bottom part and expose better for you to see the urethra. Then why two catheter sets? Because sometimes some ladies, especially the older generations, have a lot of holes in them. Sometimes you might mistaken that one for a urethra, but it's not. And sometimes when you push it in,
You can't just actually take it out and put it in a different hole. That can cause infection or UTI.
so definitely you have to bring another one. So after you made a mistake with the first one, keep it there, get another one, and put on the other hole. Usually you can get it on the second try. Then next, IV therapy. Nurses may insert and maintain IV fluids for patients who require medications or fluids. And yes, definitely. So IV insertion skill is a must here in the United States. You can ask someone to help you insert this, but it does take up your time if you can able to access an IV, and you can ask anyone to help you during that time so everyone's busy. So having this skill is definitely a plus. Then next, collecting and analyzing lab specimens. Nurses are responsible for collecting and labeling specimens for laboratory testing and interpreting the results. Not really. Collecting for IV things, normally it's not the nurses, it's the phlebotomists. But depends for hospital to hospital. So that's one less job for nurses. Other labs that we normally do is like for like sputum, urine, stool. So these are the most common things that we normally collect from the patients. Then we're the ones sending it to the lab. There's something abnormal here or that we need to take note, or like for critical values, then we have to inform the doctor. So it depends on your protocol for that particular hospital for reporting these kind of things. The next, number 7, patient education. Nurses often provide patients and their family with information about their conditions, medications, and treatment plans. Yes, this is a typical everyday thing for us nurses here. And it is important for you to be able to communicate well and relay the information that you can find in the patient's chart, given that you are not violating the HIPAA. Okay, like they say, prevention is better than cure. So it's best for you to give ahead advices for these patients, like patients who are prone for falling down, patients who are going for a procedure the following day. So you have to tell them like the NPO. So patients who are going for specific procedures in the morning. So you can tell them what specific diet they're not allowed to during that night or during that day. And sometimes you have to involve the family in these kind of things, because sometimes they will forget and sometimes they won't realize that they're giving something that they're not supposed to. So you have to inform not only the patients but also the family. Then number 8, assisting with procedures. Nurses may assist physicians with various medical procedures such as intubation or central line placement. Yes, definitely you have to know how to do these kind of things, and it is simpler if you know where to get these things or the items that the doctors might use during this procedure. So if there's like a scheduled plan, like bedside lumbar puncture thing, which normally they don't do anymore, but if they do, like for other simple things, so you can help by providing things ahead, like preparing and know where things are. It will make things easier for you, for the patient, and for the doctor as well. Number 9, documenting patient care. Nurses are responsible for documenting patient care in medical records, including vital signs, medications, procedures, and other relevant informations. Yes, definitely that's one of our most important thing being a nurse here in the United States, is to document properly. And not just our documentations, but you have to make sure that the documentation for your subordinates, like your CNAs, are complete and accurate. So that is part of your role. Any discrepancy or any mistakes on your documentations can or possibly result to lawsuit if there's something that happened to these particular patients. So it's best to document as accurate as you can and as timely as you can. The next will be number 10, patient advocacy. Nurses may act as advocates for their patients, ensuring that their needs are met and that they receive the best possible care. And yes, definitely, this is really a part of us. So if you see some neglect from parents or from visitors coming in, you should be able to defend your patients and tell them this is not good, this is not right. Your patients need a rest, you need to get out, you have to go out of here, especially if they're causing the patients so much stress, like drama, and you can eliminate those by asking the patients or the family to leave the area. So that's one way to be an advocate for the patients. And other things is you can help them by giving more information on what they can do for certain scenarios that could help their protect their advocacy. So there's a lot of options. So I think for ChatGPT, that's the only thing that he or she or this thing provided. 2 things I can add is number 1 is NG insertion. That's one of the basic things that we normally do here is insert NG. Especially if patient like suddenly just develops some signs of SBO or small bowel obstructions. So we do insert those. And it does come in handy if you know how to do this properly and you learn some few techniques on the road. Another typical thing that we normally do here is draw blood from PICC lines or CVL lines. So definitely you should know how to do that. For some hospitals, it does require a specific like a bedside training or like competency program in order for you to do this. But nowadays, most of the time, they don't really do this anymore. So you have to get a little bit of basic and try to practice a sterile technique in doing this. Then one more thing I could add is insertion or accessing the Mediport. Most patients who are like cancer patients, most of them do have like Mediports or ports that are under the skin, and when they go to the emergency room, they want the nurses to access them versus putting an IV on their hand. So that's one skill that we have to learn or research a little bit about it when you come here to the US, because this is quite common for them here. It's not as hard, but it's actually easier than putting an IV on your like peripheral hand. But the only thing is you just need to know how to do it with sterile technique and somehow to use the dressing that they provide in a particular institution. So it's easier than what you would think. So it is really doable. And another thing that includes with this skill is learning what kind of tubes to use for a specific lab results. So that's one of the things was new for me, because I never drew blood in my life being a nurse in the Philippines. So you should know which color to use for like a yellow, the blue, the purple, the red, So those kind of things. Or you can actually ask the lab, call them and ask or check with them what kind of labs or tubes you have to use for this specific test and how it is done. So you have to take note of this, like like flipping, how many times you flip, how many times do you have to swirl, do you have to put in an ice, and those kind of things. So it is a must. And another skill related to this is you have to know how to do a dressing for your CVL or Mediport or your PIC lines. This is like a part of everyday thing, not really every day, like every once a week or few days a week. So you have to know how to do these skills. So again, check with your hospital, check for the policy, check how they're actually doing this. Normally it's like every 7 days or as needed. And of course, you have to maintain sterile technique. So that is definitely important with this skill. Then another skill that I would add is how to transfer a patient, especially patients who are like weak or have like some one-sided weakness. So you should be able to know how to do this safely for your patients and of course for yourself as well. So you have to protect yourself with your back. So you have to get with those proper techniques, proper postures on how to do certain transfers that will provide you like a better life in the future. Because one mistake can break your back or cause you some problems that can really debilitate your career as a nurse. So definitely learn how to do this safely. So I think that's it for the common nursing bedside skills that you should know. If you have any more comments or suggestions, please comment down below. I would really appreciate those comments, okay? Again, if you learned something from this video, please click the like button, subscribe, and share to my friends. To my friends. So if you like this video, please click the like button, subscribe, and share to your friends. Again, I'm Nurse Juan de la Cruz, your OFW nurse. Thank you for watching. God bless. Bye-bye. Stay safe.